Hello there. Today we are going to look on the modified Aldrete scoring system. This type of a scoring system is typically used for the patients who have undergone operation under the anesthesia, mild sedation, moderate sedation, or under the deep sedation. So here this scale help us in evaluating the patient condition after the sedation. So first activity, we need to check whether the patient is able to move voluntarily or following commands. If all the four extremities are moving, the score is 2. If only two extremities are moving, the score is 1. If no extremities are moving, the score is 0. Check on the respirations, the second point, whether the patient is able to deep breathe properly, and the patient, whether he or she able to cough when you are doing the throat assessment. Then patient is dyspneic, shallow breathing, or limited breaths, the score is 1. If patient is completely apnea, the score is 0. Why we need to check the respirations is because the patients under the sedations will be affected with their respiratory system. The third part of assessment is the consciousness of the patient, whether the patient is fully awake. By self, the score is 2. If the patient is arousable on your call, the score is 1. If patient is completely unresponsive, the score is 0. The fourth thing you need to check is the circulation of the patient, whether the blood pressure, present blood pressure plus 20 mmHg is equal to the pre-operative blood pressure, the score is 2. If the present blood pressure plus 20 to 50 mmHg of the previous pre-operative blood pressure, the score is 1. Blood pressure of now plus per 50 mmHg of the pre-operative blood pressure, the score is 0. Then the fifth element you need to check is the oxygen saturation levels of the patient, whether the SpO2 level more than 92% on the room air, the score is 2. Here the SpO2 levels we can come to know on the monitor, where we are going to have close monitoring of the patient. Whether the SpO2 level need to maintain 90% with the oxygen, then the score is 1. If SpO2 is more than 90% with the oxygen, then the score is 0. Usually 9 to 10 points helps in confirming the patient is in the safe zone after the post-operation, where you can discharge the patient from the recovery room. This is all regarding the Aldrete scoring system, and this is very useful in evaluating the patient after the post-sedation, because sedation plays a vital role on the body, and it is going to affect the patient if it is given in the wrong dosage to the wrong patient harmfully. So that is the reason why we need to have close monitoring of patient. This is for at least 30 to 45 minutes post-operatively. Assessment is must and should.